Men are notorious for not taking care of themselves, so why should our foot health be any different? Well, if your home remedies are not working, it might be time to see a professional. We asked the specialists at Tri-County Foot and Ankle about some of the most common male maladies they see when us guys finally do come walking through the door.
We overlook our feet, we abuse our feet all day, and the only time that it gets attention is when it hurts, and that ruins our day.
Men are usually more stubborn when it comes to going to see a doctor. They're usually more, I'll just tough it out and it'll get better on its own. And usually when it's not getting better, it's not getting better. By the time they decide to come in and make the appointment, you're having to kind of make up for lost time, so to speak.
One of the most common injuries we see in the office is plantar fasciitis.
Plantar fasciitis.
Plantar fasciitis.
It's probably one of the #1 conditions that we see in adults. It is absolutely incredible how many people have it.
Plantar fasciitis is heel pain.
It's basically an overuse injury where the ligament on the bottom is basically inflamed.
And those are some of the toughest patients to treat too, because they want to be active, but at the same time, you got to give it time to go away.
We do physical therapy for it, where we stretch out and teach the patients how to stretch after they finish the physical therapy to try to keep the condition from coming back.
One of the therapy modalities we use in our therapy department is called the Graston technique. This is where our therapists will use instruments to really work on conditions that are stubborn, like heel pain or Achilles tendonitis. And the goal of that Graston technique is to break up scar tissue, increase blood flow to help you heal quicker.
We also make something for them called an orthotic, which repositions their foot, has them walk appropriately, and in extreme cases, sometimes surgery has to be done.
In general, we see a little bit more Achilles ruptures in men just because they're going out playing basketball with their buddies on the weekend, and it's a kind of a return to activities and sports that you haven't done for 20, 30, 40 years.
Everyone tells you exercise, 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 but no one really emphasizes stretching. When you don't stretch, tendons get shorter, they'll start to pull, possibly even tear. Preventative medicine of stretching every day, and especially the more active you are, the more you want to stretch.
Athlete's foot is pretty common. It's usually seen in between the toes when people get a burning, itching, not to be confused with neuropathy. There's usually signs on the skin where it's a little bit of redness, some peeling, some cracking, usually itching in between the toes. It is something that people can treat at home, but not all athletes' feet will respond necessarily to over-the-counter treatments. Sometimes they need a stronger prescription, in which case it doesn't hurt to come in and get it looked at.
Listening to your body is a huge portion of a patient's home and health care, whether it be foot, ankle, anywhere else in medicine, honestly. Knowing yourself and knowing when something isn't quite right and seeing the right person in the right amount of time before it gets too bad. So rather than trying to wait to see if something clears up, it's a really quick appointment. You just make it, you come in, you get some peace of mind, and then you're back on your feet again, hopefully sooner rather than later.
You'll find information for Tri-County Foot and Ankle when you click the Fit Feet for Men StoryLink icon online at yourhometownhealth.com.